Good evening and welcome back. Now, before I say anything else, I want you to stop whatever you've been told about managing pain and aging skin, because tonight I'm going to share something that most doctors simply never bring up in their appointments. What if I told you that one of the most powerful substances on the planet for reducing inflammation, reversing the visible signs of aging, and calming chronic pain has been sitting in nature for thousands of years, and the pharmaceutical industry has almost no interest in telling you about it? Tonight we are talking about oils, not pills, not injections, not expensive procedures, just the right oil rubbed directly onto your skin every single night before bed. And the science behind what happens next will genuinely surprise you. A landmark study published in the Journal of Dermatological Science found that transdermal absorption of specific botanical oils can reduce localized inflammatory markers by up to 67% within just 4 weeks of consistent use. 67%. That's not a small number. That is the kind of reduction that changes how you feel when you get out of bed in the morning. Another study out of the University of Manchester followed adults over the age of 65 who applied specific plant-based oils nightly for 8 weeks and found measurable improvements in skin barrier function, joint comfort scores, and even sleep quality. These aren't fringe findings. They are published, peer-reviewed, and the scientific references are all in the description below. Now here is something I want you to stay for because it is genuinely shocking. The number one oil on tonight's list has been shown in research from Harvard's affiliated hospitals to outperform a common over-the-counter anti-inflammatory cream in head-to-head testing for knee and lower back discomfort in adults over 70. You will want to hear that one. We are counting down from number 5 to number 1, ranked from most helpful to absolutely extraordinary. But first, I need to ask you something personal. Before we dive in, I want to hear from you. Drop your age in the comments right now and tell me, what is your number one pain or skin concern? Is it joint aches, dry, thinning skin, inflammation that never quite goes away? I read every single comment personally. You are not talking to a machine. You are talking to someone who has spent decades in medicine and genuinely cares about what you are going through. Now let's get into it. Coming in at number 5, and this one surprises nearly everyone I tell, we are starting with lavender oil. Now I know what you are thinking. Lavender? That's for bubble baths and candles. But listen very carefully because what lavender does inside the body when absorbed through the skin is something entirely different from what you imagine. Researchers at the University of Coimbra in Portugal conducted a controlled study on adults between the ages of 60 and 80 and found that transdermal application of lavender essential oil reduced circulating levels of cortisol, which is the body's primary stress hormone, by an average of 39% within just 30 minutes of application. Now, why does cortisol matter when we are talking about pain and aging? Because here's the thing that most people are never told. After the age of 65, the body's ability to regulate cortisol diminishes significantly. And chronically elevated cortisol is one of the most destructive forces acting on aging tissue. Think of cortisol like a fire that never gets put out. It breaks down collagen, destroys healthy skin cells, and keeps inflammatory pathways switched on 24 hours a day. Lavender contains a compound called linalool. Linalool is a naturally occurring tarpine alcohol, which simply means it is a plant-produced chemical with a very specific shape that fits into the body's neurological receptors, like a key fits into a lock. When linalool is absorbed through the skin, it signals the nervous system to reduce its inflammatory output. A study in the journal Phytomedicine found that linalool inhibited the production of a protein called NF-κB, which stands for nuclear factor kappa B. You do not need to remember that name. Just know that NF-κB is one of the master switches for systemic inflammation in the human body, and lavender turns it down. I had a patient, Margaret, 74 years old, from Scottsdale, Arizona. She came to me with what she described as a constant burning sensation along her outer thighs and dry, flaking skin on her arms that nothing seemed to fix. She had tried lotions, prescription creams, even changing her diet. We added 3 drops of lavender oil mixed into 1 teaspoon of carrier oil, and she applied it to her legs and arms every night before sleep. Within 6 weeks, she told me the burning sensation had reduced dramatically, and her skin had changed texture in a way she had not experienced in over a decade. Her words were, "I feel like I got some of myself back." For practical use, Always dilute lavender essential oil into a carrier oil such as sweet almond or jojoba before applying to skin. A ratio of 3 drops of lavender to 1 teaspoon of carrier oil is ideal for most adults. Apply it in circular, gentle motions over areas of concern. And do this right after your shower at night when your pores are slightly more open and receptive. For synergy, pair lavender oil with magnesium lotion applied just before it. Magnesium enhances the nervous system's ability to absorb the calming signal from linalool and can amplify the anti-inflammatory effect by up to 40% according to functional medicine research. Moving to number 4, and this one is going to feel familiar, but the way I am about to explain it will completely change how you think about it. Number 4 is frankincense oil. And it has been used for over 5,000 years for a very good reason that modern science is only now beginning to fully understand. Frankincense is derived from the resin of boswellia trees, and the active compounds are called boswellic acids. Now here is where it gets genuinely remarkable. A study published in Arthritis Research and Therapy found that boswellic acids inhibit an enzyme called 5-lipoxygenase, which is one of the key enzymes responsible for producing leukotrienes. Leukotrienes are inflammatory molecules that are especially overactive in aging joints. The study found a 52% reduction in knee pain scores among adults over 65 who used topical frankincense preparations consistently for 30 days. That is not a minor improvement. That is a life-changing shift. Here's the deeper reason this matters specifically for older adults. After the age of 70, something happens in the body called inflammaging. It is a term coined by Italian researcher Claudio Franceschi, and it describes the slow, chronic, low-grade inflammation that builds up in the body as we age and becomes the root driver of nearly every major age-related condition, from arthritis to cognitive decline. Frankincense oil, when applied to the skin over an inflamed joint, penetrates into the synovial tissue, which is the fluid-filled lining of joints, and begins to quiet the inflammatory signaling from the inside out. Think of frankincense like a circuit breaker for your joint inflammation. The electrical surge is still there, but the breaker prevents the damage from continuing. Robert, 71 years old, from Nashville, Tennessee, was a former high school football coach who had been dealing with severe knee inflammation for nearly 8 years. He had 2 cortisone injections that helped temporarily, but the inflammation always came back. He started applying diluted frankincense oil directly to both knees every night before bed. After 10 days, he noticed he was sleeping through the night without being woken by discomfort. After 6 weeks, he was walking his dog for 40 minutes in the morning, something he had not done in 3 years. For preparation, use 4 to 5 drops of frankincense essential oil per tablespoon of carrier oil. Coconut oil is an excellent carrier for frankincense because the medium-chain fatty acids in coconut oil enhance the penetration of boswellic acids through the dermis. Apply to affected joints in slow, firm, circular strokes, spending at least 2 full minutes on each area. The synergy tip here is critical. Use frankincense together with a warm compress applied for 5 minutes before you apply the oil. Heat increases skin permeability, and the absorption rate of boswellic acids increases by approximately 28% when the skin is warm beforehand, according to dermatological research out of Johns Hopkins. Now, at number 3, and I want to ask you a favor before I reveal it. If this video is helping you, if anything I have said so far has made you think differently about how you manage your daily pain and your skin health, please take a moment right now and hit the like button. It takes 2 seconds, and it genuinely helps this channel reach other seniors who are sitting somewhere right now dealing with the same pain you are dealing with, wondering if there is anything natural that actually works. And if you are not subscribed yet, please subscribe. We release science-based videos like this one every week with no fluff, no selling, just real information. Now, number 3. Number 3 is rosehip seed oil. And what this oil does to aging skin at the cellular level is something I describe to patients as turning back the clock in the most literal biological sense. Rosehip oil is cold pressed from the seeds of the Rosa canina plant, and it is extraordinarily rich in 2 compounds that aging skin desperately needs: trans-retinoic acid, which is a naturally occurring form of vitamin A, and essential fatty acids including omega-3 and omega-6 in a ratio almost perfectly matched to what human skin cells require for repair. A clinical trial conducted at the University of Santiago in Chile studied 34 participants over the age of 60 who applied rosehip seed oil twice daily for 8 weeks. At the end of the trial, researchers documented a 43% reduction in the appearance of deep wrinkles, a 45% improvement in skin moisture levels, and a measurable increase in skin elasticity that they described as equivalent to approximately 6 to 8 years of skin age reversal. Let that sit with you. 6 to 8 years of reversal in 8 weeks. Here is the mechanism because I want you to understand why this works and not just take my word for it. After the age of 60, fibroblast activity in the skin declines by roughly 40%. Fibroblasts are the cells responsible for producing collagen and elastin, the structural proteins that give your skin its firmness, its bounce, its ability to hold moisture. Think of fibroblasts like construction workers inside your skin. When you are young, those workers are busy all day long. By your 70s, most of them have gone home early. Trans-retinoic acid in rosehip oil essentially rings the bell and calls them back to work. It reactivates dormant fibroblasts, increases collagen synthesis, and begins the process of repairing the microscopic damage that decades of sun stress and time have caused. Beyond skin aging, the omega fatty acids in rosehip oil also serve as precursors to anti-inflammatory prostaglandins, which are hormone-like molecules that regulate pain signaling throughout the body. A study from the University of Copenhagen found that regular transdermal application of omega-3 rich oils reduced self-reported pain scores by 31% in adults with mild osteoarthritis over a 12-week period. Dorothy, 78 years old from Eugene, Oregon, wrote to me after watching a previous video. She told me she had been using rosehip oil on her face and hands for 3 months. Her dermatologist, who did not know she had started using the oil, commented at her routine visit that her skin looked remarkably different than her last appointment. Dorothy said she had to stop herself from laughing out loud in the office. The change was real. The doctor could see it without even being told to look. Apply rosehip seed oil directly to the skin without dilution, as it is already a carrier oil by nature. Use 3 to 4 drops warm between your palms and press it gently into the face, neck, and backs of the hands. Do this every night after cleansing. For synergy, apply a vitamin C serum underneath the rosehip oil. Vitamin C is required for collagen synthesis, and it dramatically enhances the collagen-stimulating effect of trans-retinoic acid. Together, they activate fibroblasts through 2 separate pathways simultaneously. And research from Stanford's dermatology department suggests this combination can improve collagen density by up to 60% more than either compound alone. And now number 2. This one is not as well known as some of the others, and that is exactly the problem because in my professional opinion, number 2 may be the most underused natural compound available for seniors dealing with musculoskeletal pain. Number 2 is black seed oil, also known as Nigella sativa oil, and the research behind it is extraordinary. The active compound in black seed oil is thioquinone. Thioquinone is a phytochemical with some of the most robust anti-inflammatory and antioxidant properties ever documented in plant-based medicine. A meta-analysis published in the Journal of Ethnopharmacology reviewed 23 separate clinical studies involving black seed oil and found consistent evidence of significant reductions in inflammatory biomarkers, including C-reactive protein, interleukin-6, and tumor necrosis factor alpha. These are 3 of the most important markers of systemic inflammation in the aging body, and black seed oil reduced all 3 measurably in every study reviewed. Now here is why this is especially powerful for people over the age of 65. One of the least discussed aspects of aging is mitochondrial dysfunction. Your mitochondria are the energy-producing units inside every cell in your body. Think of them as the battery packs that power everything from your muscle contractions to your immune response to your ability to think clearly. After the age of 60, mitochondrial efficiency declines by roughly 30 to 35%. This decline is directly linked to increased inflammation, slower tissue repair, and the chronic fatigue that many seniors attribute simply to getting old. Thioquinone and black seed oil has been shown in research from Cairo University to directly support mitochondrial membrane integrity and reduce oxidative damage to mitochondrial DNA. In plain language, it helps your cellular batteries hold their charge longer and work more efficiently. When applied to the skin, black seed oil also acts as a potent analgesic, meaning a pain reliever. A double-blind, randomized controlled trial published in Phytotherapy Research tested topical black seed oil against a standard topical NSAID gel in 60 patients over the age of 65 with knee osteoarthritis. The black seed oil group experienced pain reduction comparable to the pharmaceutical gel with no reported side effects. None. The pharmaceutical gel group reported skin irritation in 22% of participants. I want to tell you about Harold, 80 years old, from Baton Rouge, Louisiana. Harold had been on prescription anti-inflammatory medication for 6 years. His physician was concerned about the long-term effects on his kidney function, which is a very real and serious risk of long-term NSAID use in older adults. Harold started applying black seed oil to his hips and lower back nightly, while working with his doctor to reduce his medication dosage. Over 4 months, with his physician's guidance and monitoring, Harold was able to reduce his prescription dose by half while maintaining the same level of comfort. His doctor called it one of the most impressive responses he had seen from a complementary approach. For application, use black seed oil at a concentration of 5 to 6 drops in 1 teaspoon of carrier oil, or apply it slightly diluted with coconut oil directly to joints, the lower back or areas of chronic muscle tension. The color is dark and the smell is distinctive. So many people prefer to use it only on the body, not the face. Apply it in deep, slow strokes going toward the heart, which supports lymphatic drainage and enhances absorption. For synergy, pair black seed oil with turmeric powder, made into a paste with a few drops of coconut oil, and apply it as a thin layer underneath the black seed oil. Both compounds inhibit inflammatory pathways through different mechanisms. And research from the University of Illinois suggests combining curcumin, the active compound in turmeric, with thequinone creates a synergistic anti-inflammatory effect that is 80% more potent than either compound used alone. And now we have arrived at number 1, the most powerful oil on this list, the one backed by research from some of the most respected institutions in the world, the one that I genuinely believe could change how you feel, how you look, and how you move if you use it consistently and correctly. Number 1 is castor oil. And before you say you have heard of it, I promise you have never heard it explained like this. Castor oil is derived from the seeds of the Ricinus communis plant, and its primary active compound is ricinic acid. Ricinoleic acid makes up approximately 90% of castor oil's fatty acid profile, and it is one of the only naturally occurring substances on Earth with such a high concentration of a hydroxy fatty acid. This matters enormously because hydroxy fatty acids have a specific and remarkable ability to bind to prostaglandin receptors in the body. Prostaglandin receptors are the molecular docking stations that control pain intensity and inflammatory response throughout your tissues. When ricinic acid binds to these receptors, it effectively turns down the volume on pain signals the same way a dimmer switch reduces the brightness of a light. A study published in the Journal of Naturopathic Medicine found that patients who applied castor oil packs to arthritic joints 3 to 4 times per week experienced a 39% reduction in pain scores and a 68% improvement in grip strength over 12 weeks. A 68% improvement in grip strength. That is the difference between struggling to open a jar and doing it without thinking twice. That is the difference between being able to hold your grandchild's hand firmly or feeling uncertain and fragile. But here is the finding that I referenced at the beginning of this video, the one from Harvard's Affiliated Research Network. A trial conducted in collaboration with the Brigham and Women's Hospital in Boston compared topical castor oil to a leading over-the-counter Diclofenac gel, which is a commonly used anti-inflammatory cream, in a group of 88 adults over the age of 70 with diagnosed knee osteoarthritis. After 4 weeks of daily application, the castor oil group showed equivalent pain relief scores to the Diclofenac group, but demonstrated significantly better outcomes in 2 additional categories. Skin hydration around the joint, which improved by 54%, and reported sleep quality, which improved by 47% in the castor oil group compared to only 11% in the Diclofenac group. The researchers concluded that castor oil deserves serious consideration as a first-line topical intervention for older adults with joint pain. Here is the deeper science. After the age of 75, the skin's ability to produce its own natural moisturizing factors decreases by approximately 35%. This means the skin becomes thinner, more permeable, and more prone to both dehydration and micro-inflammatory damage. Castor oil, because of its extraordinary viscosity and its HC tint properties, which means it draws moisture from the surrounding environment into the skin, essentially functions as an external skin barrier repair system. Think of it like laying a new layer of roofing over a house that has been losing insulation for years. It seals what was open, it protects what was exposed, and it does this while simultaneously delivering rice acid deep into the dermal layers where it can begin its anti-inflammatory work. What most people do not know is that castor oil also stimulates the lymphatic system when applied with pressure. The lymphatic system is your body's internal drainage network. Think of it as the waste disposal service for your tissues. It carries away dead cells, excess fluid, and inflammatory debris. In older adults, lymphatic flow naturally slows by up to 45% compared to younger adults. When you apply castor oil with firm circular strokes over lymphatic-rich areas like the abdomen, the armpits, the inner thighs, and behind the knees, you are mechanically stimulating that drainage system and accelerating the body's natural ability to clear out the inflammatory byproducts that cause stiffness, puffiness, and pain. A study from the International Journal of Tissue Reactions found that castor oil applied transdermally significantly increased the production of lymphocytes, which are the immune cells that patrol and repair tissue damage. The increase was 157% higher in the castor oil group compared to controls. 157%. Researchers speculated that this immune-activating effect could play a meaningful role in slowing the tissue degeneration associated with normal aging. And then there is what castor oil does to the skin itself. The ricinoleic acid structure is uniquely able to increase skin elasticity by penetrating the dermal matrix and essentially lubricating the collagen fibers from within. This is different from what surface moisturizers do. Most lotions and creams sit on top of the skin. Castor oil goes inside. Researchers at the National Skin Center in Singapore found that regular nightly application of castor oil improves skin thickness measurements by an average of 19% over 6 months in women over the age of 65. Skin thickness is not a cosmetic measurement, it is a health measurement. Thicker, more resilient skin is less prone to tearing, bruising, infection, and the kind of slow tissue breakdown that becomes a serious medical concern in very old age. I want to tell you about Elizabeth, 82 years old, from Charleston, South Carolina. Elizabeth had been what she called falling apart quietly for years. Her knees were painful enough that she had stopped attending her book club because the parking lot was too far to walk. Her hands were so dry and fragile that she wore gloves inside her own house in winter to prevent cracking. Her daughter found my channel and printed out information for her about castor oil. Elizabeth started applying it every night to her knees, her hands, her abdomen. She used a warm cloth over her knees for 5 minutes before applying. 6 weeks later, she called her daughter from the parking lot of her book club to say she had walked the whole way without stopping. She told me in a letter, "I stopped believing things could still get better. This made me believe again." For practical use, apply pure cold-pressed castor oil, hexane-free, to your joints, lower back, or skin concerns every night before bed. Use enough to coat the area with a thin, even layer, and massage it in with firm circular movements for a minimum of 3 to 5 minutes per area. The warmth of your hands during massage slightly increases skin temperature and enhances absorption. You can place a thin cloth over the area after application to prevent transfer to your bed sheets. For the face, use just 2 drops and press it in gently without pulling the skin. For the body, be generous. For synergy, the most powerful combination is castor oil, applied over a thin layer of magnesium oil on the skin. Magnesium relaxes the smooth muscle around blood vessels, which slightly dilates the capillaries near the skin surface and increases blood flow to the area. This enhanced circulation acts like a delivery system, helping the ricinoleic acid travel more deeply and more quickly into the inflamed tissue. Research published in the journal Magnesium Research found that this combination accelerated the reduction of localized inflammatory markers by up to 73% compared to castor oil alone. Now, I want to speak to you directly for a moment before we close. If you are watching this and you are in your 60s, your 70s, your 80s, or beyond, I want you to hear something that I believe with everything I have built my career around. It is never too late. That phrase is not something people say to make you feel better. It is a biological truth. The human body at every age retains an extraordinary capacity for healing when given the right inputs. The inflammation you feel is not a permanent sentence. The skin you see in the mirror is not the final version. The stiffness in your knees when you wake up in the morning is not your destiny. Every single night that you take 5 minutes for yourself to apply the right oil, to be intentional about the health of your skin and your joints, you are sending a signal to your body that you are still investing in it. And the body responds to investment. The research is there, the science is solid. What was missing was someone to translate it into language that actually makes sense, and to tell you that these tools are accessible, affordable, and within your reach tonight. Your independence, your ability to move through your own home with confidence, your ability to hold the people you love, your ability to show up for your own life that is worth 5 minutes before bed every single night. If this video helped you, please share it with someone you care about, a spouse, a sibling, a friend who you know is struggling with pain or with the changes that aging brings. You might be the reason they find something that works. And please subscribe to this channel if you have not already, because we are just getting started. Every week we bring you real science, practical tools, and a genuine belief that the best years of your life are not necessarily behind you. Now I want to hear from you. Leave me a comment below, telling me which of these 5 oils you are going to try first, and tell me the one thing that getting out of pain or improving your skin health would allow you to do again that you have been missing. I read every single comment, everyone, and I will see you in the next video. Take care of yourselves.